Hi guys, this is Emma, Rose, Dylan, Yusuf, and Alana presenting RIPS case number 4. So getting right into the case, we have two main characters at play, Larry and Dawn. Larry is an outpatient physical therapist who has been working at his clinic for the past 3 years, and Dawn is an outpatient physical therapist assistant, and he's been working at the clinic for the past 5 years. Since these two do work together, they have built a relationship. Larry typically relies on Dawn in the clinic because Dawn has been there longer. Larry and Dawn have also become close friends outside of work, hanging out and even sharing family vacation together. Larry and Dawn also have been practicing on each other with manual therapy, including joint mobilizations, and they switch off being the patient. So here's the case in question. We have a patient who enters the clinic following an arthroscopic right knee surgery. Larry initially evaluates the patient, and in his plan of care, he includes joint mobilizations. After a couple of progressive sessions, Larry then delegates this client to Dawn. He's confident in Dawn's abilities despite joint mobs not being in the PTA scope of practice. Dawn then performs a joint mobilization, in which the patient lets out a cry of pain. Larry, who's standing nearby, hears this, ends the session short, and informs the patient to call their PCP if any pain and swelling persist. Larry then checks on the patient after a couple days, and he's told based on an MRI update there's new damage to the knee. The patient asks how long Dawn has been a PT for, when Larry begins to realize he never actually clarified that Dawn is in fact a PTA and not a PT.
The RIPS realm that this situation falls under is individual. This is because of the relationship between Larry and Dawn and the situations around that. Dawn is more knowledgeable in regards to the clinic since he's been there for longer than Larry, so this creates an awkward dynamic where Dawn is more quote-unquote in charge. Larry and Dawn are friends and they practice on each other all the time as well. So this creates an awkward dynamic about work boundaries and what's in the scope of practice for a PTA versus the PT and what is okay outside of their friendship in regards to work. And then the moral judgment for this is individual process. This is because Larry needs to recognize his right and wrong actions and what is right and wrong regarding this scenario. He needs to decide whether to tell the patient that Dawn is not a physical therapist, and he also needs to decide what boundaries he needs to set up with Dawn in the future so scenarios like this don't happen.
All right, so for the RIPS model, the S stands for situation, and in this case, this would fall under the issue or the problem category of the situation. Larry is directly having an issue with himself because he violated the scope of practice of PTAs because Dawn is a PTA and was allowed to treat patients without them knowing. He failed to provide informed consent to the PT and now must face the consequences, and this could have been easily prevented had Dawn just followed the scope of practice and they had wore the correct badges.
Looking at the APTA Code of Ethics, the first principle that I focused on was Principle 2, and specifically 2C. So for Principle 2, I place emphasis on 2C because Hank, the patient, isn't provided with the proper information necessary to allow him to make informed decisions about his physical therapy care. Larry, the PT, keeps trying to avoid correcting and informing Hank that Dawn is a PTA and not a PT, and didn't inform Hank from the beginning that Dawn is a PTA and not a PT. Beyond Hank's session, Larry and Dawn do not follow dress codes that help differentiate who is a PT and who is a PTA, and Larry realized that he introduces Dawn in a way that obscures his role as a PTA instead of a PT. Okay, so for Principle 3, I focused on 3B, 3D, and 3E. For 3B, Larry did not demonstrate professional judgment informed by professional standards, evidence, or practitioner experience. This is because, despite it being legal in their state for PTAs to perform Grade 1 and Grade 2 mobilizations, it is frowned upon by the APTA that joint mobs are performed by PTAs and not PTs. On top of this, Don did not have hands-on experience with joint mobilizations, either as CEUs or through his education, only education on joint mobilizations in theory. On top of this, looking at 3E, Don did not have the proper supervision for doing joint mobilizations. If this was his first time doing joint mobilizations on a patient, the PT, Larry, should have at least been supervising him more closely rather than just standing within the same room working with a different patient. For 3D, the conflict of interest here is that Dawn and Larry are good friends, and this clouds Larry's judgment in letting Dawn do the joint mobilization. The last principle that I focused on was principle number 4. This is because despite Larry learning that Hank believed that Dawn was a PT, he didn't make an effort to correct Dawn so that Dawn would be informed that he was being mobilized by a PTA and not a PT. He tried to sweep it under the rug and hope that Hank would forget about what happened.
Lastly, I'll be talking about the recommendations. So our recommendations for this case, the immediate course of action is, of course, to disclose the error to the patient with full transparency. It's important to mention and clarify Don's role as a PTA and not a PT, and explain the scope of practice breach to the patient. We would also recommend that they notify the clinic leadership to follow the facility protocols for reporting events such as that. The clinic can also host an in-service to educate the clinicians for future prevention, so something like this doesn't happen again. There, they can review the scope of practice for both the PT and the PTA, the state practice acts, and the importance for staying within that to stay safe as a clinician. Then there needs to be some professional accountability, specifically from Larry, which is the PT. He must accept the responsibility for delegating such task to Don, the PTA, when he knew the appropriate scope of practice. He should also document the incident thoroughly, include what occurred, the patient response, and the action taken afterward to make things better. Then we would also recommend that they reestablish their professional boundaries. Don and Larry must set clear professional boundaries to prevent their friendship from influence their clinical judgment in the future. It will ensure Don receives the appropriate supervision to stay within his scope of practice and the state practice acts. They must immediately stop all informal practice of manual therapy on each other. This will ensure that everyone understands their role in the profession. Some more preventions for future violations, we would recommend that the company invests in a website where patients can research staff members to understand their role and their concentrations prior to coming to treatment. They should also implement a clinic standard where all staff wears a clear identifiable badge that allows their and shows their credentials, either PT or PTA, or even an aide. We would also recommend that they mandate that every provider must introduce themselves with their name, their credentials, and the role in the plan of care before treating a patient for the first time. So something like this doesn't happen again, and everyone can stay on the same page, whether it's a patient or the clinician. They should also host a monthly in-service that focuses on the clinical education, ethics in clinic, diagnosis and to keep everyone on track and up to date with research and things like that. Lastly, we would encourage clinical culture where staff members use open communications, question unsafe delegation of tasks, and respect professional boundaries.
So, in conclusion, it would be important for Larry to reflect on what had happened. Between Don not wearing his badge properly and not giving consent to the patient about that Don is only a PTA would have been important. Though his friendship with Don is important, patient care comes first and there has to be a line drawn. Following the scope of practice is essential and it is not wise to go outside of it. It is important to take into consideration informed consent when caring for a patient because lack of consent can have harmful issues, which in this case had occurred. In the end, it should be highlighted that everything that could have happened in this case could have been prevented.